Hi, everyone. Welcome to the medical component of VeraVia. I am Dr. Derek Lawrence. I am a naturopathic doctor and the head of functional medicine here at VeraVia. My goal is to try to help you understand the medical component and how we integrate functional medicine, naturopathic approaches to health, well-being, weight loss, stress management, and why I particularly feel it's a really important aspect for our clients to understand. So let me give you a run through of what the medical component of our program really looks like. Okay, first off, we have a pretty extensive intake form, and in this we ask symptoms, medications, past medical history, current health issues. We're really trying to understand, all the little pieces of the puzzle, so that I can look over those, connect the dots, and then, share with the team some of my not only concerns, but also some ways that we can shift and personalize your care to maybe have the most success possible, or to look out for certain limitations that may arise. So when people choose our comprehensive program, that includes a medical visit, not only with myself, but also we do lab work as well. So Monday morning, we have our phlebotomist come in and draw blood for lab work. And we look at lab work that helps us understand different kind of variables of our client's physiology. So I'm very much interested in things like blood sugar regulation. This can play a huge role in people's inability to properly lose weight. It can actually play a huge role in their mental health. The roller coaster of the highs and the lows can often go hand in hand with blood sugar regulation. We are interested in what I call cardiometabolic health, and this is how things like cholesterol, the good cholesterol, the bad cholesterol, inflammation, okay, and even things like stress hormone play a role in creating a kind of overall cardiovascular risk picture. And so we look at those things to understand, are our patients at risk, and what risk are they at? But furthermore, even things like cholesterol and inflammation, these cross barriers into affecting other health conditions. And one of the things we like to do during our consult is educate our clients on why things like cholesterol matter. What does it actually do in the body? Why having too much of it may not be a good thing. Why having not enough of it may be not a good thing. Why inflammation matters. A lot of people can actually feel inflamed, but don't really realize you can actually measure this as a lab test. And there's numerous different ones we can look at. And so understanding the inflammatory load of a patient is really important from my perspective, because that is a major component of pretty much all chronic disease, and also things like mental health. Neuroinflammation can play a big role, as well as inability to properly lose weight. It's very challenging to lose weight when we are a big ball of inflammation. Of course, there's also the kind of side effects of having a relatively inflamed system as well. This can affect things like stress hormone production. And who here suffers from stress, right? I think we all do. And stress management is an incredibly important pillar of our program. And I think what we can illuminate from the medical perspective is that you can actually measure stress hormone. You can measure how high it is. Is it dysfunctional throughout the day? And we look at this and we talk about it. And it allows us an objective measurement to say, yeah, you have too much stress hormone. And so how do we address that from a medical perspective? Because there are things you can actually do, not only behaviorally, right, which is what our whole behavioral health program is based around, but also what can we do physiologically or through nutrition to change our stress hormone level. And just like inflammation, it's very challenging to lose weight when there's a lot of stress hormone coursing through our veins as well. Our labs get rounded out by looking at markers of liver health, by looking at a couple hormone markers as well, and then some markers of nutrient deficiency. Common ones that are found and often aren't run in standard lab work that's done annually with people's primary cares. So we're trying to really understand our patient's metabolic health and physiological health with this lab work, and take into consideration that just because sometimes labs are fine or in the normal range doesn't mean that they're good, right? I don't really want my patients to be normal. I want, normal people, unfortunately, are overweight. They often struggle with mental health issues, and the number 1 and 2 leading causes of death are heart disease and cancer, and that's a normal existence. I want my patients to be extraordinary. So it is my job to make sure that the team is aware of how to best serve you during your stay. Do exercises need to be modified, intensified? Does food need to be shifted one way or the other to understand or to treat a particular medical condition? Do our trainers need to understand if there's going to be certain limitations that you need to have due to previous injury or other physiological limiting issues? And my job is to be the anchor point to say, look, these health challenges may be presented. How do we change and individualize your program so that it fits you perfectly? Okay, that is our goal. As a naturopathic doctor, I understand the value of nutrition. I understand the value of stress management. I understand the value in the complexity of how our mental health affects our physical health. And so that really puts me as a head point for being able to truly understand and modify, if needed, the program so that you are going to get the most out of your stay. Because of our ability to individualize our clients' programs and really understand them and the minutiae involved in their lives, we're really able to navigate the obstacles that may present themselves in taking this care home. And as a team, that is what we are incredibly passionate about, is making sure that not only do you have a good stay, but that the information that we are trying to share with you gets implemented and is practically available and able to be implemented at home. Because health doesn't stop when you leave. And in fact, that's really when it starts, when the rubber starts to hit the road. That's also why I avail myself to continuing care with a lot of clients, because we're often just starting to get to some really exciting physiology with them. Oftentimes illuminating aspects of their health that they've never even addressed before, that have never been brought up to them before. I can't tell you how many times that we've uncovered a person's hypothyroidism, uncovered someone's celiac disease, uncovered someone's leaky gut, and how it's contributing to their overall health. And these problems don't just fix themselves in an instant. I really wish they did. But we often build a lot of momentum in our care together during this day, and I continue with them afterwards so that we can actually see these problems come to a resolution. And that's important, because having someone on your team that you trust, that you're able to communicate with, allows for a very kind of authentic and healing relationship, and that's something that I'm interested in with all my patients. So I hope that allows you to understand our medical component a little bit better, and I hope to see you soon at VeraVia.